Okay, hi everyone, good morning. My name is Tayler Middleton, and today I'm going to be talking to you about Well Living House and Anduzhe, Mino, Nesewinong, or Place of Healthy Breathing. First, I want to thank my practicum supervisors, Dr. Janet Smiley and Tasha Shields, and my professors, Natalie Franson, Betty Taylor, and Renee Monchelin. I am currently living and completed my practicum in Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Toronto is also home to many diverse First Nations, Inuit, and Métis peoples. Anduzhe, Mino, Nesewinong is a comprehensive Indigenous COVID testing and vaccination site that incorporates Indigenous models of healthcare and best practices. Well Living House is an action research center that focuses on Indigenous infants, children, and their families' health and well-being. For my practicum at Well Living House, I mainly focused on the We Count COVID project. Anduzhe is the site where data is primarily collected for the project. The goal of We Count COVID is to develop an Indigenous community-owned database about the COVID-19 spread and impact on First Nations, Inuit, and Métis peoples in Canada. This project is by community for community, making it pretty unique for large-scale Indigenous health research. And the information that is gathered from the project will be used to shed light on areas of Indigenous health that need better funding or more supports. And the three organizations leading the project are NAMI Res, or Native Men's Residents, Seventh Generation Midwives Toronto, or SGMT, and Well Living House. As the project progressed, so did my roles. I started as a greeter for individuals coming in for COVID tests. I took various trainings and helped with the input of data. I also assisted Andrea Martel, a PhD student under Dr. Smiley, to create a short documentary about the project, the site, and the three organizations, which was really fun. And as Anduzhe began administering vaccines, I helped with the clinics just to keep things running smoothly. And I also helped create a resource information hub, which reminded me of the community asset mapping we did in Health 403 with Natalie. For my practice scenario, I focused on culturally safe health programming and how central it is to the successful health and well-being of Indigenous peoples. The flow of the clinics relies heavily on communication and collaboration, and three different organizations collaborating to deliver safe and effective health programming. For my scenario, the PHSP values I focused on were Indigenous knowledge and the right to self-determination, community-based approaches to research and knowledge development, and partnerships with people and populations served. So for my scenario, I explored and connected course concepts and skills. At Anduzhe, the vaccine clinic days can be so energizing and exciting and quick-paced and busy. And one day I noticed the flow of people moving through the site was pretty disorganized, which can be kind of unsafe. So I found a staff member and they listened to me, saw where the issue was, and we worked together to solve the problem. This is a pretty simple but really important example of effective communication in interpersonal teams. I used critical and creative thinking to try to help people feel more comfortable by always introducing myself with my name and asking for theirs. Sometimes even just kneeling down when people are waiting for their tests or their vaccines instead of standing over them can just bring a more human connection. For ethical reasoning and action, I kept possible triggers in mind with my language and actions. And for cultural safety and competence, I commit to an ongoing practice of continually learning how to be a better ally. The highlights of my practicum were the vaccine clinics, getting to know the staff and clinicians at the site, and making connections with the community members who came through. The truth and reconciliation call to action that I chose to focus on was number 22, which calls upon people who possess a voice that can advocate on behalf of Indigenous peoples to incorporate and centralize Indigenous healing practices within the Canadian healthcare system. And my commitment to operationalizing this is to use my voice and ask individuals what they need and offer to help them obtain any services they may request. The greatest challenge I encountered in my practicum was feeling like I had too much freedom in my roles because my roles did change a lot. There was a certain lack of structure in the beginning. But how I overcame that was advocating on behalf of myself, just pushing through my nerves and taking the initiative to talk to my supervisors and figure it out together. The highlights of my BA were making friends through group work, learning how to work from home, and gaining skills through doing things like this and communicating virtually. And finally, considerations for future PHSP students. Don't be afraid to be the annoying person in the classroom. If you have a question, someone else definitely has that question. You're only benefiting everyone else by asking it. Stay on top of things, stay organized. If you can do something early, do it and remind other people about it because I forgot many times. And then when you're doing group work, use Zoom. I didn't use it until my third or fourth group, and it changed the way that I connected with people in the program and made it feel much more like a genuine connection and cohort. And finally, find a routine that works for you. Treat school like a job and take breaks and give more time than you think you'll need, and then be surprised when you don't need it. And thank you.